Hello, everybody. Welcome back to another Monday Learn with Flo. We're going to continue our autoimmunity series today, all the way through the month of May here. It has been a hit. I've been having so many great sidebar conversations, great consults with individuals, answering questions and DMs of people really thanking me for diving into this topic of autoimmunity. Like I've shared in some of our past videos, if you've been keeping up with us, the statistics around autoimmunity are quite staggering. Really thinking about how there's 80 to 100, and that list is growing, by the way, 80 to 100 known different autoimmune diseases. 23.5 million people struggle with autoimmune disease diagnoses every year, most of those being women. And we've gotten a chance to really kind of lay the landscape and talk about why that might be the case, where the prevalence of these is coming from, not just for women, but just where the prevalence is coming from and why they're becoming so much more common and why they're continuing to grow by the minute, right? So with our autoimmunity series, we've gotten to establish kind of what autoimmune disease is. So as a review there, an autoimmune disease is a dysfunction of the immune system that then targets a downstream tissue. So we understand too, 70% of our immune system lies in our gut. So we've also gotten a conversation to talk about, so there's a gut influence here as well too. Yes, very much so. There's usually a genetic predisposition. There's an epigenetic trigger, which we'll get into a little bit more today. And there's a sense of a leaky gut. That is really a perfect storm that will really exacerbate or set off a full-blown autoimmune disease. Now, remember, autoimmune disease, again, is dysfunction in the level of the gut, at the level of the immune system. The target tissue is really just the victim here. So what we start to see is this catabolic or this breakdown response because our body is sending antibodies towards this target tissue. So in a case of a Hashimoto's, for examthis isn't a thyroid problem. The thyroid is really just the target tissue. So yes, do we start to see the thyroid atrophy in a long-standing, undiagnosed and untreated Hashimoto's situation? Yeah, we do, but it's not a thyroid issue. The thyroid is really just the downstream assault, right? Same thing when we think about things like rheumatoid arthritis. It's not the joints, it's the immune system. Or when we think about things like ulcerative colitis, it's not the colon, it's the immune system. We think about things like celiac disease, Sjögren's. I mean, the list goes on and on of where these autoimmune diseases are really popping up, and we're, from a traditional medicine standpoint, I feel like kind of chasing our tails because these individuals are being sent off to specialists like endocrinologists, neurologists. And yes, these specialists are going to be absolutely imperative as part of the integrative health team for these people, but they're just really able to stop the damage, right? It's like, all I can really do is like try to mitigate symptoms here. I'm not really able to talk about or figure out why this is happening in the first place or what those other strategies might be to really look at supporting the gut, supporting metabolic health, supporting nervous system regulation, and talking about how the greater scheme of body, hormone, gut health fits into an autoimmune disease picture. And that's what I'm really passionate about bringing to you guys with this series, is a more complete conversation versus just like, if you have Hashimoto's, you just go on thyroid meds. It's like, yeah, that might be absolutely necessary for that individual, but they should be utilizing those medications while they're working on a bigger picture of why is this popping up in the first place and what can we do to mitigate flares, manage symptoms, and even reverse a lot of this immune system dysfunction. So we got an opportunity then last week to really build on, okay, we know what autoimmune disease is, we know it targets certain tissues, we know it's really a whole body systemic thing. It's not just a downstream target tissue. And then last week we got to talk about the stages of autoimmune disease and why a lot of times it sneaks up on people. So as a reminder, the 3 stages of autoimmunity are going to be stage 1, which we call silent autoimmunity, that's where antibodies are present, but there's not as much downstream damage to be done. So the symptoms here can be relatively mild, and some people even ignore them. This is usually some of the first signs of hormonal imbalances or gut issues, the brain fog, the fatigue, the joint pain, where we kind of just push through our day to day and don't start to make those connections that like, oh, maybe I'm needing an entire pot of caffeine to get through the day because my fatigue is so bad. And now we start to develop a caffeine issue and then we can't sleep. Yada, yada, right? So it's like, that's the early stuff that we start to do to really just like power through these internal messages that our body is trying to send to us. We're just not listening. We're like, yep, I hear you, fatigue. Here's more coffee. It's like, no, this is our body trying to communicate something like we need to pause, stop, like, correct and right the ship before things go completely bananas. Stage 1 is, like I said, easily ignored symptoms that are kind of overlooked. We just power through them and develop some pretty gnarly habits that can actually just accelerate this process, which we'll talk about today. So stage 1 can quickly turn into a stage 2. So we go stage 1, silent autoimmunity. Stage 2 is where we're really seeing autoimmune reactivity. So yes, we're seeing the antibodies, but we're also seeing symptoms now. These are now where it's like, okay, now the fatigue, now the brain fog, now the insomnia, now the anxiety, the depression, the gut issues, the inflammation, the blood sugar imbalances, the I'm getting sick all of the time, like now we're starting to like, I need to see somebody, I need to chirp up about this. But we may go to our primary care provider and they're like, oh, your labs look normal. See you again next year, right? It's like there's not enough that our labs would really warrant a diagnosis at this point, unless you work with, like I said, an individual that really knows how to look at a bigger picture here and rule out some of these things. Then if stage 2 doesn't get recognized, then we're going to really be kind of a sitting duck until we get to phase 3. And phase 3 or stage 3 is going to be that full-blown autoimmune disease. We have antibodies present, we have significant symptoms, and now we're having like tissue destruction happening. So all of those 3 phases are very apparent now in that stage 3 process. So I really wanted to bring to light what are some of those early signs and symptoms that I don't want you guys to necessarily ignore, because those are usually the symptoms that bring people into my practice. And it's, they have seen this person or they've seen that person and they feel like they've been dismissed or they've been ignored, or they've just been trying to like push through it with like different fad diets. And it's like weight loss resistance isn't just like diet harder. It's like, that's not the goal here. It's like, let's ask our body, why is it not responding to traditional mentality around energy balance? It's like, if you have to practically starve yourself to lose weight, there's a bigger issue going on here, right? It's like, that's not normal. So the things that kind of bring people in to me with the fatigue and the brain fog, the joint pain, the energy levels, the weight loss resistance, the anxiety, the menstrual cycle symptoms, it's like these are things that I take very, very seriously, because I know that they could be, if we don't stop this, right this ship now, I know that there's just going to be bigger issues for them down the road. And so having that listening ear of someone that's like, I get it, and like that's something that we definitely want to start thinking and putting some proactive measures in place now, so that you're not just brushed off by another practitioner, and it's not something to where you're just kind of a sitting duck for a bigger diagnosis. If it's not autoimmune disease, it's type 2 diabetes, or it's osteoporosis, or it's who knows what else kind of builds if we ignore some of those early stages. So once we recognize those, the more proactive we are about it, the better outcomes that we get. It's a lot easier to manage it once it's like stage 1 or stage 2 versus allowing it to get to stage 3. That's where we really need to like, kind of all hands on deck, usually to get that individual out of a pretty tough predicament now at this place. So when we think about stage 1, stage 2, stage 3, a lot of people are thinking, they're like, okay, so like, how do I stop that progression? How do I, like I said, recognize early signs and symptoms, and then really understand what can I be doing about it to make sure that I'm not part of that progression? So I always want to really dive in first and think about what does accelerate or kind of precipitate this autoimmune progression. I know none of us are really going to want to hear it, but I speak the truth when I say, in short, fast, too long, didn't read, here's your Cliff's Notes version of what accelerates the autoimmune progression. Stress. Yes. Massive eye roll. Everybody checks out at this point in time, right? But when I say stress, you're not thinking about stress in the fact or the way that I'm thinking about stress. A lot, yes, you have your uncontrollable stressors of an angry email from a boss, I hate my job, I'm arguing with my partner around finances, my kid is annoying, like whatever it is. It's like, yes, those are going to be uncontrollable stressors. We all have stress like that throughout our day. It ain't going away. You're not going to make it all better. It's just the learning, how do I make my body more stress resilient? And how do I reduce controllable stressors? What am I accidentally maybe doing in my day-to-day life that is inadvertently causing my body more stress that I'm not even connecting the dots? So when I say stress, I don't say it in the sense that's the most unhelpful way of going to a doctor or going to a practitioner and they're like, you just need to lower your stress. You need to control your stress. When someone says that, especially to a female, oh, all hell breaks loose. It's kind of like telling a female, it's like, you just need to calm down. It's like, that is not a helpful strategy or a helpful sentence in any way, shape, or form, because stress is going to happen. It's not going anywhere. We need to understand, how do I manage my body's physical reaction to stress? And this is a whole nother category of what I call nervous system regulation that I'm very hopeful gets even a bigger scene in medicine going forward, because I know that I use it with all of my clients in some way, shape, or form, helping them develop nervous system regulation tools as part of our strategies. Yes, is eating in a blood sugar balancing way, getting adequate amounts of protein and fiber, controlling and consuming anti-inflammatory foods. Yes, those are all stressors on your body. So there is a nutrition pillar to stress management and regulating your nervous system. There's also a movement strategy to regulating your nervous system. I want you moving enough, but I don't need you out there running ultra marathons and being a cardio bunny trying to lose 3 pounds, right? There's also a lifestyle pillar to this where we need to think about circadian rhythm and hydration and caffeine and alcohol and all of those types of things. So when I say stress accelerates autoimmune progression, I don't really want people to concern themselves around stressors that they can't control. You're going to have traumatic events. You're going to have family disease. You're going to have grief. You might have past traumas. You might have, like I said, significant, like healthy or happy stressors like multiple pregnancies, breastfeeding. You're starting to connect the dots of why women might be a little bit more vulnerable to this autoimmune disease progression, because sometimes for some women, the trigger that kind of really sets off an autoimmune disease progression could be pregnancy. There's so many times for women where they come in and I'm kind of collecting a health history and they're like, well, it all started after my 3rd kid. I'm like, oh, yep. We've landed on something here. It's like, how close together were the pregnancies? Did you breastfeed them? Did you have a traumatic birth experience? Were they vaginal births? Were they C-sections? I mean, guys, when I talk about like a stress pattern, 90% of it is probably in your health history. Yes, we can look at current labs, and I think that that's going to be a big one. But the best practitioners shouldn't just be looking at labs. They should be asking the bigger questions of like, what got you to this place? Because that's probably where 90% of my answers is going to be in health history, current labs, current day-to-day, like, when do you wake up? When do you go to bed? What's your day-to-day stress, anxiety? What does your job setting look like? What's your nutrition routine look like? Like, that's going to give me most of my list of the current stressors that are on your body that I want to help you learn, how do I take these off? Because if I don't take those off and I have all of these controllable stressors that I'm putting on my body plus the uncontrollable stressors of life, that is a magic combination right there for a quicker disease progression. Your stress bucket is just overflowing at that point. So when we talk about the stress bucket, we have to talk about the nervous system, right? So we have two halves of our nervous system. We have a sympathetic fight or flight, and then we have our parasympathetic rest and digest. So when we think about stress, all of these things are hitting our body at once, right? Our brain's job is to kind of prioritize and triage, like, ooh, what really matters and what can we kind of throw off? But our body internalizes all of it. All of our controllable and uncontrollable stressors, if we had to put an analogy to it, it goes into one common bucket, right? So we have a stress bucket. Uncontrollable stressors might fill that bucket up for some people. Their uncontrollable stressors in their life are very, very high. Maybe they have, especially like a perimenopausal woman where she might still be caring for young children in the home, but she might also be caring for aging parents. Throw those in the uncontrollable stress category. I'm a full-time mom. I work outside the home. I have side gigs. Maybe you have a troubled relationship with parents. Maybe you have past traumas. Maybe you have a special needs child. Maybe you have, there's all of these things that go into this uncontrollable stress bucket. So for some people, their uncontrollable stressors might fill their bucket 60, 70%. And it's like, woof, your bucket is already pretty heavy. And then on top of that, they're like, and I do keto, and I do intermittent fasting, and I tried Whole30 3 times, and I go to the gym 5 times a week, and I this, and I sleep 4 hours a night, and it's like, oh my gosh, like the controllable and uncontrollable stressors, their bucket is overflowing, right? It's filled up 70%, and then the controllable things that they're accidentally putting on top of it, they're overflowing. When your stress bucket overflows, that is when your body is stuck in that fight or flight system. Oh my gosh, physical symptoms start to ensue. When we're stuck in fight or flight, the number one thing that happens is immune system dysregulation. So that's why when I say that stress progresses, stage 1 to stage 2 to stage 3 autoimmune disease, that holds true for wherever your stress bucket is overflowed. So thinking about that, it's like, okay, so I have this stress bucket. I need to determine like how much of my stress bucket is filled with uncontrollable stressors, how much is filled with controllable stressors. And as long as I keep my stress bucket from overflowing, I'm good. Yes, you don't have to be perfect. You don't have to eliminate all stressors in life. It's not realistic. Don't bother yourself with it, right? You're not going to eliminate all of your exposure to toxins throughout your life. It's like, nope, you're going to find them. You're going to be exposed to them just with the air that we breathe, but we need to create a body that's resilient to them. So that way these things don't overflow your stress bucket. So when we know that common analogy, it's like, okay, so I need to figure out what stressors can I control and how do I start to pull that back so that my stress bucket isn't overflowing. This is what we call nervous system regulation. Nervous system regulation is when I help individuals identify specific tools and strategies, not just lower your stress, but like, no, what are we doing as day-to-day repetitions, just like we day-to-day repetitions, and what are we practicing to make sure that we are managing our nervous system. So yes, this gets into the woo-woo side of things. I love the woo-woo side of things. If you don't, you may not have a great time here, and that's okay. But I'm going to introduce you guys to them anyway because they are legit prescriptions that I include with nutrition and movement strategies for individuals, not just honestly for autoimmune progression, but for hormonal imbalances, gut issues, all of that good stuff. So it's important to note that when we think about nervous system regulation, it is not a one-size-fits-all blueprint. So there is some trial and error process here. I usually give people a handful of tools and it's like, let's try them. Let's see what sticks. Let's see what you like. Let's see what kind of fits your capacity, your time, your budget, your preferences, things like that. So it's not a one-size-fits-all blueprint, but you do have to practice these things, not just when you're stressed. We don't form new neural pathways when we're stressed. When we are already actively in that fight or flight state, our body is just triaging the scenario. So don't just think like, oh, I only do that when I'm like actively stressed. It's like, no, you need to practice these every single day so that your body has a greater resiliency to stress, right? That's what we're doing here is we're training the nervous system and we're learning how to stretch the nervous system just like we do in the gym. The nervous system is a muscle. We absolutely have to train it. So super passionate about like, do not tell somebody just to lower their stress. What are we doing? What are the practices that we're actually giving this individual as repetitions that they need to work into their day-to-day routine to stretch their nervous system? And so that way there's less physical, visceral response. There's less stress bucket overflowing when they do have or come up against controllable or uncontrollable stressors. Okay, so I kind of separate them into two categories. Proactive tools or repetitions. These are things that you do when you're actually calm. Now you can do them when you're triggered or when you feel anxious, but these are the things that you practice like proactively to make my stress response more robust. Then we have our reactive reps or our reactive tools. And these are the things that I go to like when I'm actively feeling triggered or when I'm actively anxious, right? It's like, ooh, I need to bring myself out of this overflow response. So we kind of have two different buckets. So proactive tools to increase stress resiliency. Number one, blood sugar balanced meals. A blood sugar low, under fueling will be the equivalent of a panic attack. So we got to manage blood sugar highs. We got to manage blood sugar lows. We need to be removing some of those inflammatory foods that can also cause a reaction in the gut, a stress response in the gut, and an overzealous immune system. Those are different for everybody. So this is just me naming off the tools. This is going to be a super customized approach. So unless I am your practitioner, I can't make specific recommendations of what those might be. But blood sugar balanced meals, removing potential inflammatory foods, adopting an anti-inflammatory diet, looking at things like hydration and minerals. Minerals are huge. You cannot just be drinking water out there. You need to be replacing trace minerals as well too. Looking at things like circadian rhythm, creating a consistent bedtime and wake time, regardless of whether it's a Monday or a Sunday. Yes, circadian rhythm alignment is huge for stress management and stress response. Getting first thing in the morning sunlight is really important for that. That's why you guys always see me on my Instagram stories taking my morning walks. Like getting sun on my eyes, sun on my skin helps set that cortisol and circadian rhythm response. Really great for thyroid health as well too. And then cold showers or cold exposure is also one of those proactive reps to practice. Even, I know not everybody will choose this tool, but even just ending your showers 30 seconds on cold, calming yourself in the cold. Don't just turn it cold and be like white knuckling it. Like you want to calm yourself in that cold. So those are some proactive reps that we can be doing. When you're actively triggered, you're going to need some reactive reps to bring you out of that stress response so you don't get stuck there, right? So we need a way to release that stress response. If you saw my reel from this last weekend, I started talking about this because cortisol is a stress hormone that causes or elicits action. It wants you to move. So if we have a cortisol, a stress, an anxious response, our body wants to release that, not store it. So it is some of those movements or some of those things are revolving around movement. So reactive reps is shaking, dancing, rocking. I know it sounds weird, but literally like getting up, standing, shaking limbs out, putting on your favorite song, dancing. Rocking is one of those, it really is what it sounds like, hugging your knees to your chest and rocking forward and backward. It is more of a yoga inspired move. Even just standing and doing standing squats, standing push-ups, anything that starts to release the cortisol through movement. Go for a walk if you have the ability to. Other things that are really helpful to get out of the brain and into the body is breath work, especially like an extended sigh or an extended exhale. You can also lay on the floor and put your feet up on a wall and practice the breath work. These are all things that help promote blood flow back to the organs. It's like, okay, body, we're okay. Like, get blood flow back to the gut, get blood flow back to the heart, blood flow back to the midline. I don't need to physically fight off a threat right now. So this is just me. Like I said, everybody is going to be different. This is high level blueprint, but I know a lot of people think in kind of my world, it's like, oh yeah, she does nutrition. It's like, yes, we're going to talk nutrition, but it's like nutrition, movement, lifestyle, circadian rhythm, nervous system support. Like those are my prescriptions, and it's usually not just diet. It's usually not just nutrition. It's a huge part of it, and you usually can't get very far if that's not a foundation, but this is something that is a whole prescriptive strategy here. So when I think about, like I said, this 3 stages of autoimmunity, we know that stress is a trigger for an autoimmune flare. We know that stress can exacerbate or accelerate that autoimmune progression. And so when I say stress, I'm not just going to sit here like a really unhelpful practitioner and tell you to lower your stress. That's not helpful at all. It's like, okay, we do know that we need to manage our body's visceral or physical stress response. So I need to give you some tools that help you figure out, how do I stretch or work my nervous system as a muscle? Because right now it's highly reactive to everything. Small or big, my bucket is actively overflowing. I need to give that person some tools to get that bucket not overflowing. And that's exactly what nervous system regulation is. So, although I can't be specific to your particular strategy, hopefully this gives you at least a couple clues into what I mean when I say nervous system regulation, or I start talking about the cortisol connection to autoimmune progression. This is what I'm referring to. So no more just manage your stress, calm down. That's not what we're about. It's about having some actual tools that are take-home strategies that you guys can actually practice and see and feel the return on investment there. So if you're interested in learning any more about that, I would encourage you to check out my Revive, Restore, Renew You program. It is actively on demand. You can go through that course and start that course at any time on Renew University, or you can reach out via my one-on-one link in my bio and click to apply to work with me one-on-one as well. So have a wonderful Monday, and practice your nervous system regulation tools throughout the week, and let me know how you feel.